in your life with dementia, Alzheimer's, or any condition that keeps them from being who they used to be? Are you nervous or scared that you may make the wrong decision or say the wrong thing? What if it progresses? How do you handle that? Today, we have Dementia Careblazer expert, Natali Edmonds, PsyD. And today we're going to talk about navigating facilities that you may need to put your loved ones in, or maybe if there's a crisis or a need to temporarily put them there. How do you do that? And then we're also going to be talking about points that caregivers that deal with dementia must know so that they can feel guilt-free and empowered to help their loved ones in the best way possible. Hello, my name is Lillian McDermott, and I'm a certified life coach and the host of the Lillian McDermott radio show. And the whole purpose of the classroom, which, by the way, just know that if this is the first time that you're turning in, that I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. As you know, my mom has suffered a fall a while ago, and with the fact that she had dementia, she needed physical therapy. It was very difficult to maneuver the system, but fortunately, my sister was able to find a beautiful facility. But unfortunately, if it weren't for us being there, my mom wouldn't have received the care they promised us. And so this prompted me to reach out to Natali, who's been in the classroom before, so that she can tell us and teach us, how can we navigate? How do we know what's right for our loved ones who have cognitive decline, dementia, or any of those different diagnoses that can require for our loved ones to need someone to support them well. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Natali Edmonds, PsyD, is here to do just that. Welcome, Natali, to the classroom. I'm so glad you're back.
Thank you for having me, Lily.
Well, as you know, I was telling you, trying to catch up just recently, back in June 1st, as a matter of fact, my mom fell and she fractured her pelvis. That was disastrous because she we didn't know what was going on. She was just in a lot of pain, but it took a little bit of while to get there and figure out where that she had a fractured pelvis bone. And it was almost a nightmare, especially for my sister, who's the primary caregiver. So let's talk about what to do in a situation like that. Dementia is bad enough, but what do we do in a situation where we are our parents' advocate or a loved one advocate with dementia or cognitive decline, and how to start the search?
Yeah, I mean, this is a big one. I can relate totally because my dad had a fall, a really severe fall, like May 1st, I believe.
Mm-hmm.
And it just spiraled. There was so many things happening, so much stress. And when they are in pain, recovering from whatever, if they have dementia, you are going to be their advocate.
Mm-hmm.
And it can be so hard to know what to do and like what to say, how to help. And it really depends. Like I found that how I needed to show up and how I got help was different depending on the environment he was in.
Mm-hmm.
So when he was in the ICU, it was different from when he was on the general outpatient floor in the hospital to when he went to a skilled nursing facility. Now he's currently in a group home. Hopefully he'll get healthy enough to be able to come stay with me. But it shifts depending on how that facility is run, who's in charge, how much my dad is able to verbalize and say things. So I don't know if there's something particular you want to start with, but
well, when it comes to that, especially with your father, he fell and you knew that he could articulate, you were there for him, you know how to navigate the system. What was your first step in finding your dad a place that was best for him, best suited for him? Like with my mom, she has dementia and she cannot articulate.
Right. So interestingly, when my dad fell, I was out of town. I got a tip from a neighbor. I ended up calling the ambulance long distance to get my dad to the hospital. But in terms of finding a place for him, so when he was getting stable enough in the hospital to go to a skilled nursing facility for rehab, I basically narrowed down based on, okay, what will his insurance cover? What are the facilities that I was really looking for close to me and where I live? Because I knew that I wanted to be checking on him and seeing him regularly. And if I chose a facility that was maybe closer to his house versus my house, it would have made it more difficult on me. So I chose a facility that, of course, his insurance would accept. Number two, was close enough by me that I could go there regularly. And then number three, honestly, like what I felt comfortable with when I visited them. So I chose like about 5 facilities in the area and I went and toured them. I didn't let them know I was coming. I just popped in because I didn't want them to like maybe put on some sort of show or something. And I really took a look at like, how did they greet me when I arrived? How did the floors look? How did the staff look? Because of my dad had really lost his physical functioning, I was really focused on their rehab department. So I wanted to go see their rehab department, see the physical therapists and occupational therapists that were there. So like I went in there like knowing what I was wanting to look for. I also asked about staff patient ratios and things like that. And so it became really apparent to me it wasn't that difficult to narrow down when I just after touring the facilities. I mean, some facilities, the front desk staff couldn't even bother to lift their head and say hello. Other facilities, I was asking about patient to staff ratio and they mentioned, well, when the call offs happen, and it was like, okay, so call offs are a common thing, which I know is probably true everywhere, but it just, they kind of missed the mark on some basic things. I looked at the eating arrangements and the different rooms and how much commotion there was, and just kind of went with my gut on those feelings. But the location I ended up choosing really was a physical therapy department that made it for me. I saw the physical therapist working with some people. I saw them escorting some of the residents to their floor and to their room. And I just thought like, this is the place. And they were the only place that offered physical therapy on Saturdays. All the other facilities shut down on the weekends, and insurance only approves you for a certain amount of time. So if you're only approved, let's say for 4 weeks of skilled nursing facility and, 2 days out of the week, nobody's there, you're not getting any of the services there. So that really helped me make my decision as well.
Wow, that's great points, wonderful points. That's why you're with us, because, unfortunately, I'm finding that more and more people my age are dealing with parents who are demented or that are going through this decline, whether they have dementia or not. My mom is 89. My dad is 92. He'll be 93 in December. And my dad sleeps most of the day. My dad's needs are different than my mother's needs. And as a result, when my mom fell, not only did we need a nursing home that had rehab, that also dealt with dementia patients. And what I discovered was they were like, their sales pitches are unbelievable, state of the art. But when I would visit, my mom didn't have any water. She was still messed. She had a mess in her diaper, So what is your advice? Because here, these places get a lot of money, but they're primarily understaffed. So
Right.
even if they say the ratio is good, if there's an emergency and your mom or dad is needing help, they won't see them for another hour or two. So
Right.
how do you, what is your comment of, does the loved one need to be with them 24/7 so that they can get the help they need?
Yeah. I mean, ideally, the family members should be able to visit regularly. 24/7 I don't think is realistic. I don't know many people who could put their whole life on hold to be with their loved one that whole time. I also know that there are so many loving family members who, for whatever reason, like don't even live in the same state as their loved one. Like I have a brother and sister, they don't live in this state. And so they weren't going to be able to visit. So I want to be respectful of the people who are in different life circumstances where being there a lot is not possible. I mean, though for those situations, I would be asking for, checkups. I would call in, ask, for an update from the staff, try to keep in touch long distance as much as possible.
Interesting.
Yeah. But for the people who are able, like I pretty much visited my dad daily with the exception of maybe a couple of days where I was out of town, but I would show up every day. Sometimes the visits I allowed to just be 30 minutes. Sometimes those visits were going to be a couple of hours. I do think it is important that you have to consider yourself in every single caregiving equation, because when we decide to just put our entire life on hold and be there for them 24/7, at some point our own health and life start to suffer.
Yes.
And without us, our loved ones would overall care would certainly deteriorate. They need us. So if we are somebody who can advocate for them, can be there for them, can do things for them, we need to take the time to make sure we're taking care of ourselves. Because if we don't take care of ourselves, there's absolutely no way that we're going to be able to take care of our loved ones long term. So give yourself permission to change it day by day. Is this the day you can visit an hour? Is it a day you can visit 2? Is it a day maybe it's just a 30-minute drop in? Like that's, make sure you give yourself permission, I think is incredibly helpful. I also think like my experience, even though I chose the facility that I thought was best for my dad, and you bring up a good point, I would not be swayed by the look of the facility. Like the facility I ended up placing my dad in didn't look fancy. I went to a fancy facility that had the beautiful lobby and everything looked so high class. I thought their care looked so poor and they didn't really even care about their residents. The look of the facility is more for the family member's comfort. It does not translate necessarily into the care the person's going to receive. So I chose a more facility that was older, but it looked like the people cared more. They had more services. They had more, care on the weekends, things like that. So that's an important point to keep in mind. But I struggled personally so much with just wanting to like go off sometimes on the staff members. Like, even though I thought I chose the best place, my dad was sitting in soiled, briefs for a long time. They would put food down next to him and he could barely even reach it. They would, after they cared for him and like maybe changed his briefs and got him cleaned up, and they would leave, but then the tray was outside of the reach. They didn't even put the tray back in. And I'm like, it's basic stuff. And I really struggled with wanting to just totally go off. Like, what in the world? This is ridiculous. I remember once pressing the call button and sitting there for 40 minutes before somebody came, because I wanted to test the call button and see how long it would take for them to come while I was there. And I had to really work on my mindset to realize that I could be assertive and I can make requests. However, I could do that respectfully and in a way that would make the staff want to help me and my dad more, rather than become the problem person. And it was this weird kind of battle in my mind between, I shouldn't have to do any of these things. This care should just be part of the process, versus, well, this is what it is. And the way our system is right now, like the standard of dementia care in our world, I think is subpar. What we consider acceptable, I think is unacceptable, but that's where we are right now. And so I had to keep myself in check and really think through, okay, what is the best way for me to get the help that I can get? And I did things like I would drop off treats for the staff at the nurse's station before I went in to see my dad. I'd drop off cookies sometimes. The first time people actually helped me get my dad out of bed for the first time ever. He hadn't been out of a bed in 4 weeks and, got the Hoyer lift and I went out and bought them Starbucks gift cards. Did I have to do that? No, but I wanted to show my appreciation in a way that I knew how. And then most facilities have like something called like a kudos card or a staff acknowledgement. So I would fill those out when somebody was just nice and pleasant. I mean, basically when somebody just did their job, but I wanted to acknowledge it and show that I see them. And it switched from the first week of me like just being like, I cannot believe this is actually what we consider acceptable care. I'm so frustrated. I'm so angry. And it really switched to when I walked on the floor, people said hi to me. I mean, people started like coming in sooner. And I think it was just because of the shift in my approach. I don't think that should be required, but I found it went really, really far, even to the point like one of the staff members, my dad wanted a Coke really bad one night. And of course I wasn't there and they didn't have Coke, and she brought one from home for him. And so there's like these little things that started to happen and fall into place that if I had lost my cool, or if I had immediately brought it up to administration right away, I'm not sure it would have turned out the way that it did, which in the end ended up being quite beautiful. But it took some extra steps on my part, if that makes sense.
It totally makes sense, because that was one of the questions I was going to ask you. How do you bring deficiencies to the staff when you know this is part of the process that you are paying for, that the insurance is paying for, or whatever that is. But I love how you shifted, because there were many times I wanted to blow and say, why isn't this happening? But every time, because I couldn't do it myself, I would go to the people, and I know my sister was also very gentle with them, and I know my brother as well, but there's that borderline of frustration, whereas, why is it that someone who who needs to hydrate has a water that is too far away from them to reach, and doesn't even remember that she needs to drink water? Why aren't more? But this place sold itself as dementia rehab, assisted living, not assisted living, but a skilled nursing facility. And for the most part, it was beautiful, but there were some of the people, some of the team members, they had like rolling of the eyes, if you asked for something. And that was very hard for me to not, combat, because I knew that they would take it out on my mom. And when you talk about memory care facilities, that is the perfect crime. That is the perfect crime. I remember my sister was paying extra for my mom to be bathed, and I went there, and my mom stunk. This is before my sister took them into their home, and my mom stunk. And I said to my sister, Asia, mommy stinks, mommy smells, aren't you paying extra for bathing? And she said, yes, absolutely. And their response was, she didn't want to bathe.
Right. That drives me crazy. And that's how you know it's not a dementia friendly facility, because if the only thing we're doing,
this was memory care,
yeah,
Natali.
exactly. It's absolutely insane that, and the average cost of a memory care facility, long-term care, is like $8,000 a month in this country. And if your approach is, do you want to take a shower? And they say no, and you think it's not you just can't do it, yet they're also taking your money extra for it. I think it's absolutely criminal, and things need to change. I do think, like, so while I'm talking about, and I apologize, I just got riled up.
But that's
okay.
I
help myself sometimes.
People that are listening are also riled up, because I'm sure that if I experienced it, and you have experienced it, that they have too. So let's get riled up.
Okay. And so personal thought here. Most of the people who get hired for these facilities, they get hired for the skilled job they do, which is, can you take a blood pressure? Can you pass medication? Do you know how to bathe somebody? Do you know how to dress somebody? Do you know how to transfer somebody? They don't get the assessments, the trainings, the ongoing support to. Now, how do you do this when somebody has dementia? How do you do this when the person doesn't understand you're actually trying to help them, or they don't think they need to take a shower? So they're not hiring for that kind of skill. They're not even most of the time training for that kind of skill, yet they're charging for that kind of skill, which is a shame. And there are times, and I think it's important that people hear this, where you need to be assertive. And that's going to involve more than just talking directly to the direct care staff. Like for my dad, he was in that facility. He was approved for 4 weeks initially, and he was in that facility for 2 weeks and had not even seen the physical therapist. So I just hiked on myself up to the physical therapy department. And, I don't come off mean right away, but I just say, hey, I'm wondering what's going on with, my dad. He says he hasn't seen anybody, what's going on? And I mean, it was such a mess. They're like, we don't have any orders for physical therapy. I'm like, what the heck is he here for? We thought he was here just for long-term care and to live out his life. I'm like, no, that's not the goal. The goal is for him to get strong enough that he can get out of bed and he would come stay with me. And so it's just like, oh, following up, let's look into that. Now I did, because he initially was hospitalized at the VA and the VA was paying for the services in the beginning. I called up the VA and I asked to speak to a patient advocate once this wasn't getting situated. Like once it wasn't resolving in the time I thought it should resolve, I called the patient advocate and I said, what's the deal? This facility says they don't have these orders from you. You say you gave them to this facility. I'm powerless and can't have anything to do. Meanwhile, my dad has been 2 weeks sitting here in a bed, just continuing to deteriorate even further. What do I need to do here? And then that certainly helped move things along, because now it's the patient advocate has this information and is making some change. So you can do that with the facility your loved one's at. I would like to speak to the patient advocate or the nursing administrator or something like that when it needs to be escalated. Like I escalated what needed to be escalated, and I took care of what I thought I could take care of. So if the staff was in the room and they had just finished changing and I happened to be there, like, oh, do you mind moving the tray over here? He likes it, when he's sitting here alone. Done, like, and if I saw that was happening, I never needed to say anything again. So I think you also have to choose your battles for what you want to escalate. Otherwise, unfortunately, you just become like the person who's always complaining about everything and never satisfied, even though you shouldn't be viewed that way. These basic things should be happening, but it was like I had to pick and choose, what am I going to really raise up the ranks?
Great points. I love the way that you discovered a way to their heart, a way to be noted. But like they say, honey attracts more bees than vinegar. And so that was great on you. Are there other things, because we want to keep that balance. We don't want harm to cause to our loved one because of our complaining. What is the balance by which you report and you say, this is not acceptable? And, you can be diplomatic or you can be kind and loving, but if it's causing harm, at what level do you say, now this needs to be reported?
Yeah. Now you can make this call at any point. Like some people are going to have different thresholds. And so if you want to do it right away on the first thing, absolutely go for it. Like I'm not here to tell people when they should raise things higher up and when they shouldn't. I think for me, I made the decision on what was the immediate negative ramification of this thing not happening or this thing happening, So like the immediate negative ramification of the tray being away from my dad, certainly like if it was away for 24 hours or something, that can be a really big deal. But I was visiting him every day at this point. So it was like, okay, I'm just going to check on this the next day. And if it was taken care of, then I'm totally fine. I don't need to raise it up the ranks. It was like, but if it was something like, like the physical therapy thing, this negative ramification, if it goes on any longer, I don't know if my dad's going to regain his muscle. I don't know if he's going to be able to have this skill. So it was like, that was very important to me. It was like in line, what they were doing was getting in the way of my ultimate goal for my dad. So like that had to be raised up immediately. So yeah, that's kind of how I filtered it through my mind, but I do want to give everybody has the like the ability and the power to just raise things up as soon as you want. For me, I think I had a little bit more threshold because of how often I was seeing him and just how comfortable I felt doing some of the things myself. I mean, I was doing things that I'm like, I don't even know if your facility would think this is legal. Like I was moving him myself. I was transferring him from his bed to the wheelchair to give him some fresh air out. But it was like, was I going to wait 40 minutes for them to come by, or was I just going to do it on my own? So, that was something I didn't raise initially because I'm like, I'm just going to take care of this. So
good for you.
Yeah.
Good for you. And the fact that you have experience, you are very experienced. You have a YouTube channel. That's how I first found you on YouTube, Careblazers, Dementia Careblazers. I believe that's your YouTube. But if someone like you who has all this experiences these challenges with our loved ones, and we want to be I mean, they're like our children at this point. They're like our children, and we would never allow a teacher to mistreat our child or a hospital to mistreat our child. But there's a different balance where you can't be there all the time to protect them, and we need to protect them by being kind to the people who are laying hands on them.
And you bring up such a good point. Like my experience going through this as somebody who's worked in long-term care facilities, been a consultant at those facilities, worked in a hospital, like there was a level of comfort and familiarity, knowing like, okay, this is who I need to talk to. I could not imagine if you didn't have that, how much more more difficult it would be. And something for everybody to know, I just recently learned this. Of all the times I've been in the hospital system for 13 years, there is something called a family care group. It is a legal requirement that every long-term care facility offer this to family members, yet I have never heard about it. So recently I've been talking with an attorney who essentially sues care facilities for a living. And so he was asking me, he reached out to me to kind of like get some of my thoughts on things. And he said, have you ever heard of a family care group? I thought he was talking about like a family care meeting. I'm like, oh yeah, we do those all the time. He's like, no, the facility is required to provide a space for family members to meet with other family members without any of the staff present on what they want to see changed, what their problems are, what they haven't been liking. And then there's a designated person that will go bring that to the staff about here's what the family members are saying needs to happen or what they're not happy with. And they are required to respond back on what they're doing for it. Did you hear about this when your loved one was in a
Well,
long-term care?
I believe that my sister participated in those meetings, but I don't know if that was a family care group. I'll have to ask her, because my sister and my brother live closer to my parents. I live about an hour and 10 minutes away from my parents, from them and my family. But
So
I'm sure I will ask her to see if that was something
yes.
that she was, but I know that she met with the administrator and the nursing staff. So that's not the same thing, right?
It's not the same. It's basically like the facility makes a place for family members to come together without other staff present so they can speak freely. They don't even have to know who it's coming from necessarily. And then there's one person that says, this is what was discussed in this meeting. This is what we want to hear back. And then they have to give back. They have to address it. It's legally required by law. But I was talking to the attorney. I'm like, well, why doesn't this happen? What's going on? Why is this not more? He's like, well, there's no incentive for the care facility to do this, to find the space for family members, let family members know about it, and then have to listen to and address everything family members are saying. There's no incentive for it, even though it is a requirement by law. So if there's nothing else your listeners get from this, if your loved one is in any kind of care facility, you can ask for information on, what's the family group practices here? Where is the location we meet? How do we get a hold of, how do we let all the other family members know about this? And who do we share our findings with?
So is there okay, so I understand that there's a location where the family members can meet to discuss the loved one's care. Is there a person, a mediator that's provided by the facility to listen to those people? So how does okay.
My understanding, and I'm not an expert in this, I just recently talked to this attorney who will be on my channel in a couple of weeks. So people who are following me on YouTube will be able to see that full in-depth interview where we go into the details about how do we make this happen and how does it work. But my understanding is typically one of the family members in that group, whether they write it up or explain it verbally, will give it to the administrator to say this was what was discussed today.
Okay. So I do know that there was a room for family to meet at the facility. I do know that because I used to walk by it. And so that is true, that it was an experience, but I didn't know this was the reason for it. So with the family care group, I'm looking forward to hearing a little bit more about that and watching your interview with the attorney, because there are I believe that sometimes people, like you said, I don't want to go gangbusters on them or attack them, because I know that I want our parents to, or our loved ones to be safe. But if you're gathering this information from family members, is that something that can be done outside the facility? Because if there's not going to be a person there listening, taking notes, then that could be done anywhere. But I wonder if they have to provide someone to listen in that conversation.
Yeah, I'm not sure. I think part of it though is they don't want they can invite people from the facility to be there if they want, and that person, they would have to provide somebody to be there. Like that's definitely in their purview to do. However, the idea is they don't want anybody to be filtered and feel like if they say something, it will be taken against them or taken against their loved one. So that's why, if they don't want anybody there from the facility, they don't have to be there. And it's supposed to be a private area for the other family members to come and meet. Now, obviously, the other family members can go meet wherever they want. The reason why it's important to have it at the facility, at least have that option, is because that's where all of them are going to meet with their loved one. So no matter where they're living or what part of the town is, it's like they are all going to the same location at some point. So if there is a scheduled meeting or time, that's just the easiest option for everybody.
Very good. Very good. I like that. I like that, that option for everybody. Is there anything else that you can think of before we move on to tips on, for caregivers when dealing with certain issues that our loved ones might have?
Yeah, in terms of dealing with the facility, I mean, most of the facilities will have some sort of ombudsman posted that you can call to and express concerns. However, those are usually volunteers with very little training. So while they're great, like, and you could use that, it might not, you might have to follow up a little bit more. You might have to be the squeaky wheel. But just in the end, like, I struggled in the beginning of, like, I didn't want to be a bother. I didn't want to make anything more difficult on my dad based on how I was behaving. And I struggled with feeling like everything I needed was a bother. But if they would just tell me ahead of time, I wouldn't need to worry. If you just told me where to get my dad's water refill, I wouldn't have to bother you right now and act like I'm disturbing your day. Like, you could work on your orientation practices. However, that being said, what I really had to work through is, in the end, I am doing what is in the best interest of my dad.
Right.
And if that means I am going to interrupt this person behind the computer who looks very busy, I am willing to do that, because in the end, it's for my dad's best care. And so I didn't care if people thought I was annoying or they wished I would go away. I always tried to stay respectful. But in the end, it's like, what do I care more about? Do I care more about my dad's outcome, or do I care more about whatever those people are saying about me when I leave? I care more about my dad's outcome. And I just kept that at the forefront of my mind.
You know, nothing good ever comes from fear. No action after fear, no decision after fear. No. So if we are looking at what is important and we're very clear as to our goal for our loved one, then that gives us the empowerment to move forward. I will tell you that we were told that my mom would need to be in the facility for 12 to 14 weeks with a fractured pelvic bone fracture. And my mom was in this facility for 7 weeks. And she's like my superhero. You would never know that she fractured her pelvic bone. And I do attribute it. And I have to tell you this is my perspective, and my perspective only. I have no scientific data on this, but this is my perspective. That because my mom had dementia, she didn't remember that it would hurt. And she didn't remember it would hurt. And so her training, and I have to give it to the team that was there, the physical therapy team that was in this group. They were phenomenal. But she did so much better when we showed up. And I remember videotaping her and seeing, like, every step was so grueling for her, but she couldn't remember that her next step was going to be grueling. In 7 weeks, they discharged her.
Wow.
In
That's amazing. That's
seven
amazing.
weeks. And
You
yes,
know, oh, you just reminded me of something I wanted to say too. I think a lot of times, because people are really stressed out and they have a lot of residents to see and things like that, a couple of times they would say, when I went and asked physical therapy, like, why didn't it happen? What's going on? They're like, oh, he refused. I'm like, okay, no, tell me what really happened. Like, what was he sleeping when you went down there? What time of day did you go down there? What did he actually say? And then eventually I was like, you know what? Tell me when you're going to be there next, and I will be there to see what actually
That's
went on.
exactly what my sister did. That is exactly what my sister did. Yeah, she
Yeah.
was so spot on with, advocating for our mom.
Yeah.
But yes, that, if we would think that these professionals have it all under control. Like, for example, being in memory care. Oh, you don't want to take a bath? Oh, no, that is not an option. That is not, you distract and you figure out a different way to get them to bathe. For my mom, she didn't want to get out of bed because it hurt to get out of bed. But because she couldn't remember, she was able to be coerced into getting out. And at the beginning, they would show up, physical therapy would show up at 10. But my sister put a stop to that, which is great. So it's very important, even though $8,000 a month is going to that particular care facility. If we want something done, we've got to be their advocate over
Exactly.
and over again. Anything else
And
you
there
want to say
are,
about that?
yeah, lastly, there are wonderful physical therapists, occupational therapists, nurses, doctors. There are wonderful healthcare providers all over the place. And I totally understand the constraint and the time issues and all of those things, but none of it is an excuse to not give the person who's staying there the care that they need to get. And I think that's the change in the direction that we need to take more seriously in this country, whether it's getting more help and hiring better help and getting more training and maybe paying them more, whatever we need to do. I understand all of the hardships from the healthcare provider perspective, because I'm a healthcare provider. I understand. But with memory care, especially with people for dementia, it's just so easy to poke your head in real quick. Want to take a shower? Time for physical therapy? No? Okay, move on. And it's like, That's what we have to stay on top of. So shout out to all the healthcare providers doing the hard thing, like totally respect that and respect you. But also we have a lot of improving to do.
Absolutely, absolutely. And speaking of which, when it comes to improving, I just want to take a little moment to talk about what we're doing here today. We're taking personal responsibility, 100% responsibility. And if you are ready to take 100% responsibility, I want to ask that you please subscribe. Go to whenyouneedafriend.com, subscribe to the website. And while you're there, please like and follow me on all social media, because this, I don't know why. I'm back to like 13 or 30 videos have been removed from my YouTube channel since 2021, because some of this health freedom information, or taking your health back, or informed choice, all these issues are being questioned and being deleted. And so I need for you to go and like and follow and share this information so that we can empower ourselves. And once the algorithms realize that we are the voice, we are the 99%, perhaps maybe this information will be out even more readily available for all of us. But for now, please like and follow, share this information, go to check out the website, check out my sponsors, and support them the way that they're supporting the classroom. Go to my Shop Now bag and support the classroom that way as well, by purchasing some of the products that are Lilly approved from head to toe. So check them out. Another way that you can support the classroom is checking out all the workshops. Now we are doing, I don't know if Natali knows, Dr. Bradley Nelson, but we're going to be doing the emotion code and body code, a seminar with Dr. Bradley Nelson in beautiful Florida. So November 3rd and 4th, come attend that event. It is just unbelievable for you to be able to tap into your subconscious mind and heal past traumas and hurts. So check it out. Go to my website and there'll be a pop-up, and you can certainly be a part of that live event November 3rd and 4th. The other thing that we just finished is the Super Gut, and this is with Dr. William Davis. We've learned how to fix our microbiome, and by the time that that this show is airing, the class is done. But the good news is you can subscribe at any time. You can take the 6-week course at any time and fix and repair your microbiome in a way that you will never be told that this is something that you can do. And then last but not least, you can become an enrolled student in the classroom. And whether it's $1 or $1,000 a month, or a one-time donation, whatever you can provide, everything is appreciated, whether it's your time, your talent, your treasure. And again, just sharing this video is part of your time and your talent. To be able to press that button is and to subscribe to the channel, that is so important. And today we have, oh my gosh, Natali Edmonds, and she's PsyD. And I love the difference between PsyD and PhD. And I'd love for you to address that in a little bit. But if you would want to learn more about what Natali is doing, you can go to careblazers.com. You can go to her YouTube channel, which is phenomenal. So share a little bit about what you're doing, Natali, and how you are helping others as well.
Yeah, so at Dementia Careblazers, 99% of what we do is completely free, and we do that through educational videos and trainings for family members who are caring for a loved one with dementia. One of the main ways we do that is through YouTube. Every single week, we put in-depth training videos on what to do in really common but difficult situations, like how to manage caregiver stress and burnout, what to do when the person with dementia is believing things that aren't true, wants to go home when they're already home, doesn't want to bathe or shower. All of the common things that many family members are struggling with, we just put them on our YouTube channel for free, because when it comes to things like that, waiting 6 months for a short appointment where you may or may not get information to help you in those situations is not really great. So it was my goal, and just giving that information at the comfort of the caregiver's own home 24/7 when it works for their schedule. And that's primarily what we do. We do have a private program called the Care Course for people who want more personal help, want to join our support groups, want to join live Q&As, meet other members, and really take the information we talk about and learn how to apply it to their personal situation. We do that inside of the Care Course, but otherwise, YouTube is the main source. We're on Facebook and Instagram at Dementia Careblazers. Lots of free, helpful information there.
Absolutely. I tell you what, it's been, I feel like you've been holding our hand through this process. You know, when somebody, and more, this is happening where people are being diagnosed with dementia, but you know, they go straight full on. That's the diagnosis, but it could be, you know, medication interaction. It could be other things, and that's where I feel I wanted to advocate for my parents, which is this really true dementia, or is it really, is it diet, is it diet, is it nutrition, is it stress, is it, you know, whatever it is. How do you advise someone who's just been told that someone they love has have cognitive decline to the point where it's dementia, Alzheimer's, or whatever diagnosis they have? What do you advise for them to be as an advocate for their loved one?
Yeah, you bring up a good point. There are things I call dementia lookalikes. Not every older adult who has memory impairment or seems to be confused has dementia. There can be so many other things going on. And since dementia, I mean, technically it's not a diagnosis, but we'll just use it because it's easy to think about in this conversation. But in order to even have a diagnosis of dementia, you have to exclude every other possibility. So has that been done? Have they had their labs drawn? Have they even had a full comprehensive assessment? A lot of times people would just go to the PCP and have like a quick 30-second screener. Well, that's not a dementia assessment. That's not even meant to diagnose dementia. On the only exception really would be if somebody is so far gone, like they're already in the late, moderate, or severe stage, which probably the family member knew it by that point, then that screener would be appropriate. But you really want a comprehensive assessment. Primarily, you want to have a neurologist and a neuropsychologist together, really put the puzzle pieces together to figure out what is going on. Because the neurologist will do like the medical background of labs, maybe take a scan of their brain, you know, look at, you know, their walking gait, things like that. And the neuropsychologist is going to be looking at how is their brain working? You know, based on what the family is seeing and what how the person is showing up, how is their brain looking, and how should it be working compared like for their age and education? And they can put the patterns together and say, whoa, yeah, this actually looks like this is this type of dementia, or actually this looks like normal aging, or this looks like depression, or this looks like anxiety, or this looks like poor sleep, or this looks like ongoing alcohol use and cannabis use. Like they're filtering all that out. And that's a very thorough, in-depth examination. I mean, typically about 5 hours.
Mhm.
And a lot of people don't get that. And in some
Yeah.
cases, it might not be appropriate because the person with dementia has progressed so far that they can't do that assessment. But especially in the beginning, when these changes are first happening and you're not sure, don't jump immediately to it is dementia. There can be other things that are going on. And even if it is dementia, there can be other things making it look worse that we can fix and that we can help. I mean, even something as simple as poor hearing. The person may not have dementia at all. It's just that their hearing is so poor, or they might have dementia, but it's not as bad as it looks. We just need to help with the hearing. That's a simple example, but that's the level of detailed detective work that really goes into a good evaluation.
Absolutely. That's a great point. I'm glad that you were talking about all the different aspects. Now, I wanted to address PsyD versus PhD, and I loved, if I were to do this all over again, I would go your route. So share a little bit
Oh,
about what
really?
PsyD, absolutely, hands on. Yeah, all the
Yeah.
way.
So, PsyD is a doctorate of psychology.
Yeah.
So I have a doctorate in clinical psychology, and a PhD is a doctorate of philosophy.
Mhm.
Generally speaking, although both can do both, depending on their training and what lane they want to take, generally speaking, a person with a PhD is going to be more in the research and in the lab, doing the studies that a PsyD is more hands-on and clinical, working with the patient. So the PsyD is looking to the research that the PhD is putting out and saying, okay, this is a treatment approach that works, or this is what's going on. Now I'm going to go in front of a human being, and using this information, I'm going to adjust my approach and my practice. So PsyD is more face-to-face with patients, and PhD is more kind of the research and behind the scenes. That being said, both can do both. It depends on the path you want to take, but that's the main difference. Is that your understanding?
Absolutely. Absolutely.
Yeah.
I love it. I love it. Okay. So let's shift a little bit. When it comes to, I was watching a video of yours that you were talking about, you know, certain things and how to handle difficult situations with your loved one who has a diagnosis of dementia, Alzheimer, or whatever condition that they have. one of them that stood out. My mom is always wanting to go home. When are we going to go home? And I always say, Mommy, don't you love your vacation that you're in? Or that, or I'll tell her, I'm coming right over. I'm going to come pick you up. And she'll go, okay. But to hear it from you, go ahead and share some of the tips to deal with dementia patients that just want to go home.
Yes, that's common. And honestly, there are so many ways to respond to a situation like this. Like there's not just one approach. In fact, in my care course, I have something called the behavior bank, and it's like all of the symptoms and all of the questions. It's like, okay, like there's more than one way to go about any difficult situation. But generally speaking, when somebody with dementia wants to go home, they are expressing some sort of discomfort about where they are right now. They're probably thinking of a home that's from their past, or maybe they're just trying to think of something that's more comfortable to them, like their current environment might not be the one that they're used to being in. And right away, I would say, just don't tell them they're already home. Don't try to say, but you're already home, Mom, because they have already told you they don't think it's their home. And so when you do that, you've immediately broken and lost this opportunity to connect with them and get valuable information about what home is like to them. And although it can be incredibly scary, I like to say, like, move toward it, get more information about it. So if they say they want to go home, you can simply just first connect with them, like, oh, you want to go home? Like, just repeat back what they're saying. And then say, oh, what do you like most about your home? Oh my gosh, that sounds lovely. Because what you're doing there is you're getting information about what is it about being home that they're missing or they're looking for? Or what are you going to do when you first get home? Because then that might tell you what they think they need to do. Do they think their mom is waiting for them and they have to make dinner? Do they think their kids are coming home from school? Because then you can adjust your approach to be more personalized. Sometimes you could just say, yeah, that sounds great. Let's pack up a little bit. And you might even have like a little bag in the corner you keep under the bed or something. Like when you start just putting little socks or t-shirts in there, you say, oh, you know what? We're going to need some snacks before we hit the road. Let's go have some. And then by then you're on to something else and
Correct.
The home is forgotten. But the minute you say you're already home, we're not going anywhere, they become more anxious and more in distress because you've just told them you don't believe them and you're not on their side. Versus taking a few steps toward them, they can really drop that anxiety and that distress because they feel like, okay, things are happening, things are good. And then from there, then you can redirect, then you can engage in something else. And before you know it, it's gone and passed. But many people jump straight to the trying to redirect, that the anxiety for the person with dementia just mounts and mounts and mounts because they're like, why are you trying to get me to have a snack right now? I just told you I want to go home. Yeah. So we do want to take some moments to let them know we hear them, ask some questions, maybe even help them pack a little bit. But I'm curious what video you watched and what I said, if it was something different, because we can go 100 different ways with this.
Oh, no. That was the gist of the video. It was the video saying, you have a playlist and the playlist is dealing with behaviors. Yeah. And so that was one of them. And your tips, although I had my own way of saying, you're on vacation, don't you love it here? Yeah. And we talk about these things, or I would say if we were on FaceTime, I'd say, I'll be right there, Mommy. I'll help you pack your bags, or I'll come pick you up. And perfect. I did that, but I never have asked her. Well, maybe in the past I've said, where do you live or whatever, but I haven't continued to ask that. So that was a great tip that I learned from that video, is to ask and dig deeper and get them to discuss. That's an opportunity to connect. So no, that was great. That was great. So the next one that I thought was important, because I know that there's mistrust, because they're always losing things and they're thinking somebody's taken something from them. How do you deal with accusations? So I know that you've got videos on that, and I want to encourage all of you to go to Dementia Caregivers on YouTube and check out their YouTube channel. Her YouTube channel is amazing. So when it comes to accusations.
Yes. So if it's an accusation toward you, that can be really difficult because you're the one trying to do all this care, and all of a sudden they're accusing you of something. Yeah. And I would really resist the urge to say, no, that's not true, because what you're doing, like, they just told you what's true for them. And so again, we introduce strain and tension in the relationship when we immediately go against it. Now, just because you don't disagree with it right away, it doesn't mean you're agreeing with them. Like, so you could come up with different things to say. And I would encourage everybody, if there's something they lose a lot, and then they blame you for, I would see if you could get a replacement for it, if you could have a safe hiding spot for it, if you could be a detective and figure out where are their favorite hiding spots so that you know to check, like, the dog dish whenever they're looking for their wallet or something, like, where their regular spots are. But when they accuse you, you can literally say, oh, you know what? I put it over here for safekeeping. I wanted to make sure it stayed safe. Here you go. Or, you know what? I think I saw that over here. Here, let me help you. Or, you know what? I want to help you find it. Or I really just want to help, or it's just something that's like disarming. You're not engaging in the fight. And again, there are so many different ways you could respond. I would take into account their personality and your personality. Like for my dad, I'm always going to be sarcastic. Like that works really well with him. And that's why, like, when we're doing live Q&As with members, it's like, tell me more about your loved one. How do they usually respond well? Like what kinds of things do they respond well to? Okay, we might want to take more of a serious approach versus a joking approach. So you always want to filter everything through that individual person, because people with dementia are individuals. It's not like a one size fits all. But yeah, I would just say, oh, you know what? I think I have it over here, or let me help you find that. Or, you know what? I'm so sorry. I think I misplaced it because I wanted to keep it safe for you. And then I might say something else after that. Like, you're always taking my things. Like, you know what? I'm so sorry. I was just trying to help. I guess I made the wrong decision. And it's just a little like, what are they going to argue with on that? And a lot of times the caregiver might struggle with that kind of approach, but just realizing that when you struggle to just say the thing that would be easiest for them to hear, you end up just making your caregiving situation more difficult because you don't let it move on. You don't let it like calm down. You keep it alive by trying to convince them you're not doing it, when in fact, they believe you are. Now, I will say there is a lot of hope for turning around relationships like that. I do a whole thing called the relationship revival. And when somebody with dementia starts to mistrust you and starts to not like you, that is a big red flag. It's time to work on the relationship, because who wants to accept help from somebody they don't like or trust?
Yeah.
Not very many people. And so doing little things every day, like asking for their opinion on something and not correcting them. Like, how many times are people with dementia saying, hey, people are asking people with dementia, what do you think about this? I'm interested in your thoughts. Oh, that's interesting. Not correcting, not arguing, just like literally taking an interest in what they have to say, complimenting them on something on a regular basis, a genuine compliment. That pink shirt looks so good on you. It matches your lipstick perfectly. Or I love your smile. Or, that's a regular little tiny thing we need to be doing on a regular basis.
Yeah.
In your mind, reminding yourself of things you like about your loved one, even if it's really hard for you. Things like in the beginning, if you really can't stand them, it might be things like, I like the fact that they have fingernails, right? Like simple. But when we get into a point where the person with dementia is accusing you of so much, we can start to get into our own mind about, why am I even doing this? They're so ungrateful. This is so hard. And that will come across in your caregiving. That will put more strain on your relationship. It will make it more difficult that they will ever want to accept your help. So focusing on the relationship, when you start hearing things like, you're treating me like a child. Why don't you give me my freedom? I don't, you're stealing everything from me. It's like the more interactions you can make that are pleasant, like not even focusing on caregiving sometimes. What are something you can do every day just for the heck of it, just for fun, that, you're not going to correct them. You're not going to say anything else. It's just like, oh man, that was so much fun with you. A simple thing is, how often do we pass our loved ones with dementia during the day and we don't really even acknowledge them or smile at them or make eye contact with them, because we know, well, we just passed them 3 minutes ago, right? But when somebody with dementia has memory impairment, they might not remember that.
That's
and
right.
Every time you pass them and ignore them, it's just a little bit more like, what's this person who's just running the household and I'm just like this person on the side. So there's like little tweaks like that if there is mistrust in the relationship, can really go far. But that's like growing a garden. It will take some time. You want to nourish it. You want to keep giving it attention.
I love this. I love this conversation. I can't believe we have like 2 minutes left in the classroom here today. There's just so much we don't know. And I know that I would love to have you back, because this is a topic that we, unfortunately, will have to deal with more and more. And I take care of myself today so that my children, hopefully they will never have to deal with this at all in the future. Any final words for caregivers when it comes to, because you were talking about, how that going back and forth of trying to defend yourself against the person who's accusing you, that's going to create stress and burnout for the person, the caregiver. Any tips that you could share in about a minute before we go, that they can handle to get better and feel better?
In some cases, you don't even have to engage with them. You can say, oh my gosh, I'm so sorry. I'll be right back. And just leave the room for a bit and come back. Like you will burn yourself out trying to like fix every single thing. Some things don't need to be fixed. Sometimes they could just be forgotten by removing yourself from the environment and then coming back later.
Wow, that was quick. That was quick.
I keep going. I tried to give the shortest response possible.
No, you are awesome. You are awesome, Natali. I'm so grateful to you. This is something that we've got to get better at. There should be courses, and you do have the courses. I want to encourage all of you to go to careblazers.com and check out Natali's website and learn more. Equip yourself for these times. And Natali, I really appreciate what you're doing. Thank you so much.
Thank you so much for having me.
And thank you for being in the classroom today. And please remember, everybody, go to whenyouneedafriend.com. We're here at whenyouneedafriend.com, and we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Natali Edmonds wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Yay. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before